Welcome back. It's still Good Morning Abuja, and yes, we've been having an amazing time so far. But there's something that is pertinent that we discussed this morning, and that is why we have a special guest in the house. Before I introduce him, though, let me ask you: how concerned about how much concern do you give to your body? How much concern do you give to your health? Do you prioritize issues of health as it concerns your everyday activities, or are you one of those people who just stay back and wait until the situation gets out of hand before you seek solution? Well, whichever of the divide you belong to, trust me, I know that stopping it in time and taking care of it is far better than trying to treat it. Like they say, prevention is better than cure. Well, this morning we are discussing blood pressure. And guess what? We have a consultant nephrologist from Zenith Medical and Kidney Center with us. I'm talking about Dr. Adeyemo. Good morning and welcome on the show.
Welcome to Good Morning Abuja.
Good morning. Good morning. Thank you so much. Thank you for
Yes,
having me.
Yeah.
yes.
Thank
You
you to
know,
all our listeners at home. Good morning,
yes.
everyone.
Just for us to get a proper understanding of what we are going to be talking about today. When they say, when we describe it and say consultant nephrologist, it sounds very big, and
Big.
people be like, which one be this one again? So just break it down for us.
Yeah, thank you so much for asking that. A consultant nephrologist is simply put is a kidney specialist,
Okay,
okay, who has gone through some training in the field of medicine and who could treat patients with kidney diseases,
okay.
essentially.
Well, it's important that we get that out there so that when you hear nephrologist, you will not be thinking, because sometimes the medical terms can be a bit, how will I put it, overbearing. You just hear them and your heart will
It's
just drop.
already.
I don't suffer today. Well, it's not like that. We're just talking kidney this morning. And the context of our discussion this morning is on blood pressure.
Pressure. Yeah.
Gladys.
Hmm. Don't even go there. I know where you're going. But let me shock you. I check it like because whenever I go to see my mom, she
Yeah.
has this she has the kit. I don't know what they call it, what they
The
used to
blood
check
pressure
the
kit.
she has it as well. So whenever I go to visit her, I make sure okay, let me just but I don't know because I think it has a routine, the way you check it. You don't
Okay.
just check it anyhow. Like either in the morning. I think she because she does her own like early in the morning before eating or so. I don't know. There's something. So but you're here to tell us more. So I'm
Well,
checking you
when
now.
we talk about blood pressure, one of the things that readily comes to mind is what we call high blood pressure. You say, oh boy, I get high blood pressure, oh boy, BP won't kill
Give
me,
me.
all those kind of stuff. So, high blood pressure is what we are looking at this morning. Of course, we know there's also low blood pressure, right, doctor?
Yeah,
Yeah,
yeah.
so we discuss this too and see how we could try to find like regular solutions to these
So,
things.
yeah.
So, let's start with high blood pressure. What is high blood pressure? What are the factors responsible for high blood pressure?
Thank you very much for this very hard question. I think it's a very topical issue which we need to enlighten our viewers on. Everybody knows that high blood pressure is commonly referred to as the silent killer. So, just to simply put, blood pressure is a condition that predisposes uh, somebody to increased risk of stroke, heart attack, or kidney problems. And when we talk about the blood pressure, we usually mention two values. For example, 130/80. So we give two values, one on top, one below. All right. So the one on top, simply to explain it, is the pressure in the blood channels when the heart is contracting, and that is
Okay.
what we call the systolic blood pressure.
Oh,
Okay.
And the one below, which is the diastolic blood pressure, is the pressure in the blood channels when the heart is relaxing.
Okay.
All right. So there has to be a minimum value for the two for optimal functioning of the heart. For example, if the pressure in the heart in the blood channel is too high when the heart is contracting, that means the force at which the heart will be pushing blood out into the blood channels has to increase,
Okay.
which means more work for the heart to do, right?
okay.
All right. So, and then if the pressure too is too high when the heart is in the blood channels, pressure in the blood channel is too high when the heart is relaxing. Okay, so that means more pressure will be transmitted back
Into the heart.
into the heart,
Okay.
and that will also cause the enlargement of the heart, and which can subsequently lead to heart failure. Okay,
Okay.
so both diastolic blood pressure and the systolic blood pressure are quite important,
Mm.
and that's essentially what uh, um, blood pressure, elevated blood pressure means. Now, when we talk about elevated blood pressure in terms of number now, okay,
Okay.
so there are various school of thoughts based on professional guidelines, right? But generally, what many people understand as elevated blood pressure is when you have a sustained blood pressure with the systolic, the one up
Oh,
of at least 140 and above, and the one below at least 190 and above. Okay, so
Okay.
when you have systolic blood pressure, diastolic of 140 over and diastolic blood pressure of 140, I'm sorry, your blood pressure is 140 over 90 persistently. Okay, that is high blood
High
pressure,
blood
which
pressure.
we also refer to as hypertension.
Elevated. Okay.
Now, who are those that are at risk of this condition? All right. We have various risk factors that can predispose to this. Age is one of the risk factors
okay.
Okay.
because as one ages, the, the ability of the blood channels to relax becomes more difficult. So
Mm.
as one ages, blood channels in the body too ages, right?
Okay.
So the blood channels will not be able to dilate enough when the heart is contracting, and that can lead to increased pressure in the blood channels. Aside age, other things, inactivity, okay,
Inactivity,
obesity,
like,
inactivity, okay, people that assume a sedentary lifestyle,
They don't
not moving
exercise.
around,
They
they
don't
don't
move around.
exercise,
oh, okay.
okay,
I
so
thought overactivity causes so maybe I was thinking when it's inactivity you are resting, it's rest mode and good for the body.
no, resting is different. When we talk
Okay,
about resting, we mean okay things like maybe sleep.
okay.
But
Inactivity.
inactivity means you are sitting down all day, not exercising your
Oh,
You're
muscles.
pressing the
Okay, so
computer. You're not
okay,
moving
yes,
around.
okay, okay,
so you don't burn calories.
okay,
Okay, so
okay.
that's what I mean by inactivity.
Inactivity. Okay.
The other things are obesity, okay, dietary indiscretion, which essentially means increased salt intake in diet.
I was going to
Is
ask what kind of
also
diet, but now you're
mm,
mentioning. Maybe.
so increased diet,
Okay.
increased salt in diet is also a risk factor
Okay.
for hypertension. Some people are born with low volume of uh, uh, filters in their kidney.
Hmm.
Okay,
Okay.
maybe due to some sickness of the mother during pregnancy, those people will be at risk of hypertension later in life.
Wow.
Okay, people who have poor sleep pattern can also be a risk factor
Mm.
for. So all these ones I've mentioned are the risk factors for what we call essential hypertension.
Okay.
Okay, when we talk about essential hypertension, hypertension without other proven causes.
Mm.
Okay, so but aside this, we
Mm.
have another hypertension class of hypertension we call secondary hypertension.
Okay.
So what that means is that they are secondary to something.
Mm.
They are precipitated by something.
Mm.
Okay, and common precipitants of elevated blood pressure in our environment are drugs. So drugs like over-the-counter painkillers,
Okay.
NSAIDs, that we call NSAIDs,
Okay.
can lead to a rise in blood pressure.
Mm.
Pills, oral contraceptive pills,
Okay.
could lead to elevation in blood pressure. Okay, nasal decongestants.
Mm.
Okay, these are also things that can lead to elevated blood. People who have background kidney diseases,
Mm.
people that have hormonal problems,
Okay.
okay, they can also have elevated blood pressure. So these ones are categorized as secondary hypertension. All
Okay.
right. Okay.
So before I ask another question, you mentioned the sleep pattern. Your sleep pattern should
Yeah.
be. So when you say sleep pattern, because most times most people sleep from 11 and they are up by 4. Is that okay, or you need to start maybe by 9, start about 5? So what's the normal healthy sleep pattern?
So for most adults, the normal healthy sleep pattern should be about 7 to 9 hours.
Oh,
Sleep that is less than that is not a qualitative sleep.
mm,
And the sleep should be at regular times
okay.
so that the body can get used to it. So if somebody wants to sleep, you have to try as much as possible to get to bed at regular times,
Mm,
not just sleeping haphazardly. And then it's also important to get on less interruption in your sleeps.
mm,
maybe take away distractions from your bedroom,
Mm.
TV, or switching on the lights. Okay, those two things might prevent getting a restful and adequate sleep.
Mm.
Okay.
So, in most adults, sleep of 7 to 9 is generally regarded as good sleep.
Okay.
Less than
Well,
that is poor.
when we talk about BP, our blood pressure, whether high, low, or elevated, is this restricted to a particular age, or is everybody could this thing happen to anybody at just any age?
Okay, so for essential hypertension, um, in the natural history, I mean, what I mean by natural history is how they develop. Is in the 20s, the blood pressure starts rising.
Mm.
And usually in the 40s, the person might start having a blood pressure in the range of hypertension, which is 140/90 and above.
Okay.
Okay, so, but in children, the definition changes.
Okay.
It's based on the categories because in the children age group,
Mm.
there are various categories.
Okay.
Okay, so they measure it based on the percentile
Okay.
above the range expected for their age.
Mm.
But generally in adults, we talk about hypertension, elevated blood pressure when the blood pressure is 140/90 and above. And blood pressure can be elevated in both young people and
And
adults.
Okay.
adults.
So the causes are different
Mm.
in adults and in children.
Certainly.
Generally, in many adults, okay, if there are no other proven causes like I've mentioned, like use of some drugs, poor sleep pattern and all that, we can assume it is an essential hypertension,
Mm.
especially if there are no other problems with when the person has gone to the hospital for testing.
Mm.
But in young people less than 40 years of age, when they have hypertension, many times it is secondary to something. So it could be that they consume some drugs, okay, sometimes even illicit drugs
Mm.
could also cause blood pressure spikes.
Okay.
Illicit drugs, over the counter, abuse of over the counter painkillers. Some might have hormonal problems. Okay, and some might also be using oral contraceptive pills,
Okay.
which could be the reason for. Some might have kidney
Mm.
disease. Okay, so when a young person, usually less than 40 years of age, develops hypertension, we must look for the cause.
Mm.
However, in older adults, many times the cause are not usually apparent. Now we
Okay.
talk
But
about
before I let you go,
essential
we need to know the
hypertension.
signs because that's very essential. The signs and symptoms to actually know that okay, I need to go and check up or meet a doctor.
That's the thing about hypertension. Hypertension is usually does not usually give any symptom.
Wow.
Wow.
So if you don't test, many times you don't uh, see that your blood pressure
It's
is
high.
elevated or normal.
Wow.
Okay, so what I would just enjoin our viewers and everybody to do is to make sure they check their blood pressure regularly, especially people that have background kidney disease, people with diabetes, people who have their family members with hypertension. This set of people should make sure they check their blood pressure more regularly. However, in otherwise normal people, blood pressure at least once a year is just fine.
Okay. Okay. Nice.
Amazing.
In fact.
Oh, let me ask this quickly. When we say there is high blood pressure, is there low blood pressure?
Mhm.
Definitely.
Now, I'm asking this because it's a very funny
Mhm.
scenario when
Mhm.
a family friend went to the hospital and they said she had low blood pressure. And then when the husband, everyone was concerned when they say she was being taken to the hospital. And when they called the husband and say, "Hey, what happened? What's wrong with Madam?" He said, Madam is enjoying this marriage so much
So
that
that she
everything is
doesn't have
working
pressure.
fine. She doesn't even have problem that she had to go
Down.
and
It's low
she did
pressure.
no problem. So now we introduce problem for her so that so low blood pressure. This is also an issue.
Definitely. So we talk of low blood pressure when the blood pressure in the blood channels, okay, the systolic is less than 90
Okay.
and the diastolic is less than 60.
Wow.
Okay. So the importance of this is majorly because it could cause catastrophic events in the body.
Okay.
Things like stroke, can happen, and things like heart attack when the blood pressure is too low.
Mm,
Okay.
mm,
The reason is that it is when the heart is relaxing, okay, that is when the blood flows to the blood channels around that surrounds the heart.
mm.
Okay, so when the blood pressure in the blood channels are critically low, it starves the blood channels that surround the heart of their own blood supply. Okay, so the heart will not be able to function properly, and it might just stop.
That's true.
Okay,
Wow.
all right. So the person can just you just hear that the person
Collapse.
collapsed. So that's what happens in most times. The heart might stop working, or even the brain might suffer some acute shortage in blood supply, and then the person goes unconscious.
Wow, wow.
Amazing. Amazing.
Amazing. Look to
Well, there you have it. You know, there are some things that are very, very critical, and we just have to give it attention. That is why, from here on the program, Good Morning Abuja, we are making a call that do make it a habit to regularly check the pressure of your blood. That is something that you must do because we want you to be healthy. Thank you, Dr. Adeyemo, for coming on
coming
the
on the
show.
program.
Thank
Thank
you
you for
for having
Um,
coming.
me.
yes, and kudos to you and all the wonderful people back there at Zenith Medical and Kidney Center. You guys are doing amazingly well here in the capital city, Abuja.
Thank you.
Yeah,
Thank you.
so well, the conversation this morning has been on blood pressure and how we can manage it. Well, you heard it from the doctor himself. There are things to avoid. Be very careful with over-the-counter drugs. Do not live a sedimentary life. Move as much as you can. And if nothing else, avoid hard and illicit drugs. Though there are so many other things that you could do. You could research it up yourself or ask your doctor for some advices. But generally, stay healthy.
Mm.
We'll go on a very short break. When we return, I am Gladys will still be here to keep the program going.